Ebola continues to spread and kill in West Africa.
The Ebola outbreak reaches America.
This morning, Thomas Eric Duncan was pronounced dead in Dallas.
I would say compared to where we were at in January of this year, the United States is dramatically more at risk, not just for Ebola, but for a whole host of other infectious diseases. I'm known as an Ebola expert because I both treated Ebola patients and had the disease myself and was lucky enough to survive. The reason that I've been a critic of the dismantling of foreign aid over the past couple of months is because I've seen how impactful it has been over the span of my career.
The African nation of Uganda is in the middle of a deadly Ebola outbreak.
The United States was providing on-the-ground humanitarian assistance until President Trump pulled the plug on USAID.
We know that the U.S. did not show up in Uganda to help make sure that people infected with Ebola in Uganda weren't getting on planes and coming to Atlanta, New York, San Diego, wherever it may be.
Ebola, any disease, doesn't care what your politics are, right? It is relentlessly looking for a host to infect. In my view, in situations like Ebola and other infectious diseases, is I want to listen to the people who've trained their entire adult lives to advise in moments like that. So that's David Lakey.
Since the outbreak of Ebola in West Africa, Texas has been taking steps to make sure that we are prepared for an event like this.
Judge Jenkins, Clay, and I, again, knew each other pretty well. And he, as the county judge, he's the highest elected official for the county. And so he is in charge of disaster response. We worked as a team. From then on, it was an all-hands-on-deck response to take care of the people of Dallas and the rest of Texas. People don't care whether you're red or blue. They just want you to stop the event, and that's what we did.
And because of that, we got FDA-approved treatments and vaccines for Ebola, which is incredible. If we don't continue to support things like responding to outbreaks abroad, continued support of new treatments and new pharmaceuticals, we are leaving ourselves open to further risk. At the same time, we're dismantling the systems that are necessary to keep these outbreaks from coming here. Those systems we need because they're effective. We need them because they help prevent outbreaks at their source. They save us a lot of money here. They save us a lot of heartache here.
When public health is cut, it affects everyone.
So what I'm more worried about is the unknown that's going to come.
I worry that we're not taking seriously how heightened this risk is. We're not putting back in place the programs that we need. And unfortunately, I say this with 100% certainty, we're going to regret this.